think you'll see more subspecialization. I think you'll see people start to focus on really subspecialties within specialties.
I'm Keith Landry. Thanks for joining us. We're talking about hospital systems in the COVID-19 era. What a year it's been in 2020. And we've got a gentleman here who's been working in hospital systems the last 8 years and knows about this firsthand and what he's seen this year in 2020. Dr. Joe Greene is a hip and knee surgeon with the Norton Healthcare system in Kentucky. Thanks for joining us today.
Yeah, Keith, thanks a lot for having me.
You bet. Wild year. I think on January 1st, there probably wasn't a healthcare provider in America who knew what they were in for in some of these larger cities across the country. What are your observations about what we've learned inside hospital systems and at yours from the COVID-19 era?
Yeah, I think we're still in uncharted waters for sure. I think that luckily the rates did not spike initially where we saw concerning things in New York City and California. In Kentucky, we did not have the spike of patients coming through the emergency room or use of ventilators. So we were able to keep our census in the hospital very low. And so it was really about 25% busy at the hospital. And so we stopped elective surgeries, which I thought was the right call, just to make sure we had enough supplies in case that surge came. But it didn't show up so far in Kentucky. Now, hopefully nothing happens here in the future, in the fall or the winter. But as of right now, we're back to full tilt. I think our hospital really does not have too many COVID patients in there. We don't have a whole lot of sick COVID patients, and we're back to 100% or 125% of our elective business. I think that we were already doing a lot of outpatient joint procedures prior to COVID, meaning do the patient surgery in the morning, make sure they're doing well with anesthesia, walking, and then get them actually home the same day. So same day joint replacement surgery. And so we were already doing that before, but now there's an even more of a push and patients are requesting it. They're doing great and the outcomes look very good. If you look at...
I'm sorry. Does the COVID-19 pandemic change business models in orthopedic surgery across America to force patients out of hospitals into these off-site locations and so on?
Yeah. I think you can do it from a hospital setting too. So I think a hospital system can discharge patients the same day, which is what we're doing. But you have to build the infrastructure to do that. So I don't know if it forces patients out of the hospital in a kind of a negative connotation, but it does accelerate or kind of force healthcare systems to develop that platform and the support for the patients to go home the same day. So yes, I think that's going to happen. I think also there'll be more joint replacements done at off-site ambulatory surgery centers. I do think that will be a future thing we'll see as well.
Interesting. How did the COVID-19 pandemic affect the way you practice, run your practice?
Yeah, I think telemedicine is something that's here to stay. We kind of were very much accelerated into telemedicine before this. We really were not doing any through the health system that I work for currently, but now we are, and we've maintained that. I think that your initial follow-up visits, post-surgical patients, are going to be great for telehealth for orthopedics because our patients from the hip and knee perspective are sore. It hurts when they walk, and having them come into the office 2 weeks after surgery just to take a look at their incision and do a little bit of education, which you could easily do on a telehealth platform, makes total sense. And then if you start extrapolating it out to guys like you and me that are working throughout the day, yet here's our computer, we could easily do a telehealth visit to see how your rotator cuff's doing 6 months after surgery. I can see your range of motion right now, make sure things are progressing, give you some tips. You can fire questions at me. I mean, it's a modern way of doing medicine, and I think it's here to stay.
Interesting. We're seeing the second wave of infections, spikes in cities across America. And one of the things we're seeing that's sort of in the news right now is these concerns that patients aren't doing preventive screenings and they're not doing follow-up visits. And they're sort of going back to the mentality of being afraid to go into offices again. How concerned are you about that when you see a trend of patients not getting preventive screenings or follow-up visits and things like that?
Yeah, so I think that's a big concern for primary primary care health providers or some specialties that manage long-term chronic diseases. In the world of orthopedics, we really treat arthritis and we treat people that are in pain. And so I think most of my patients are going to come see me if they're really, really hurting. I am concerned that somebody who has asthma or lung issues are scared of going into seeing their pulmonary specialist or primary care doctor. I think that could cause some problems long term. And so I think some of that might be able to be handled on telehealth platforms. In the world of orthopedics, though, I think patients are going to seek me out due to a pain level.
Mm-hmm. I think that's a great point. One last question for you, Dr. Greene. As you look at the last 8 years of practicing medicine in a hospital system, and you've observed sort of the evolution of how those practices are going, what are the trends you're watching for the next few years that you're really honed in on?
Yeah, I think you'll see more subspecialization. I think you'll see people start to focus on really subspecialties within specialties. And so you'll have guys like me, which probably in the next 5 years, I'll be a knee physician. That's all I do is knee surgeries. And I'll probably only do knee replacement surgery. And then I have a partner who's going to do only shoulder and a partner who's only hip. So I think you'll see that. I think you'll see a push where more and more people are going home the same day of surgery. So I think you'll see more outpatient surgeries being done on the orthopedic front. I think you'll see some more innovative, smaller, less invasive surgeries. I think you'll see more and more technology in the operating room too on the orthopedic side, like robotics, navigation, computer-assisted surgery. That kind of technology I think will be more prevalent in the operating room. So those are the kind of trends that I see in the next few years.
Wow. Everybody in the orthopedic world is going to be on their toes. Dr. Joe Greene, thanks so much for your time today. Appreciate your insights and giving us some great insights on the evolution of orthopedic medicine. Thank you so much.
Yeah, thank you very much for having me, Keith. It's been fun.